Now, I want to say a number of thank yous because this second year of medical education in Spokane would not be possible without many individuals, many businesses, many nonprofit corporations. I'll be mentioning several individuals and several organizations, but by doing so, I am not including everybody, and I apologize for those I'm not mentioning. Let me start with the Empire Health Foundation and Anthony Chang. He was an early supporter, and the Empire Health Foundation provided excellent support. The Health Sciences and Services Authority of Spokane County, Susan Ash, provided great support. You all, the businesses in Spokane, with leadership from Marty Dickinson and Tom Quigley, who's off celebrating in Hawaii, I guess, the businesses of Spokane provided key funding for us to conduct this second year of education in Spokane for these next few years. We've had the support from GSI for many years, and many individuals. I've already thanked Rich. I'll thank you again. Thank you to Rich Hadley, Scott Morris, and many others at GSI over the years. And a recent organization, and some of you in the room are members, are an organization called the Friends of Whammy Spokane. Only a few in the room. I'm sure the Friends of Whammy Spokane would enlist new members today. That organization has been led by Dave and Mari Clack, and I thank them and the members of that organization that support our students, both with their time, opening their homes, and with philanthropic support. Many, many people to thank. We at the universities, this partnership between UW School of Medicine, and Washington State University, we take our responsibility very seriously. Your support means that we must deliver. And we're fortunate that the regents of our universities, some of whom are based in Spokane, are strongly supportive and have been helping lead this program to development. And I am particularly grateful for the opportunity to partner with Lisa Brown. I can't imagine a better partner for caring for our students, supporting our students, and taking this program, which is already the best there is, but we're going to make it even better. Before I turn to Lisa for her to describe some of the bright future for Whammy Spokane, let me just say one word, not a word, sorry, a few sentences, if you give me a few sentences about research. Whammy, from the beginning, has been a program focused primarily on education, training the next generation of health professionals, especially to serve the underserved people in our region. However, for the last 30 plus years, Whammy has also been about working together, partnering together in research. There are 6 public universities that are partners in Whammy, and those universities work together in research now. I'm getting up there a little bit in age, and I've been in healthcare, as Scott pointed out, for 42 years now. I've seen a lot of change. In my view, these next few years are the most exciting, most opportunities ever available in healthcare research. We've reached a point in healthcare research where we can answer the questions we could not answer before. With the Human Genome Project, which you can think of as we now have a growing understanding of the operating system of the human genome. If you think in information technology terms, what we've done is now develop an understanding of the operating system of what causes disease, what prevents disease. What we need to do in research now is connect that basic science of understanding what causes disease, how we treat it, how we prevent it, to connect that basic science to clinical research. There's no better place to do that than Spokane. Spokane has a strong history in clinical research. Spokane is a vital partner in one of the largest grants we have, a $65 million grant that is for the area of research that's called translational research. That's when we connect what we do in the basic science labs of genetics and this operating system and how we connect that to improve how we care for patients, how we change the model of medicine from diagnosing and treating terrible diseases to preventing diseases. That's called translational research. Spokane is already a major part of that grant. And the good news that I had a chance to talk with the GSI board about recently is in a few years we'll have a chance to double that grant. So there's the opportunity to grow this important area of research where we connect the major advances in basic science with the care of patients. With that brief description of research, I could go on about research, as you might imagine, for hours. But now let me turn to Lisa Brown to hear about the bright future for Whammy Spokane.
Thank you, Paul. Well, hello, everybody. I get to do some really fun things in my job. I got to dunk Scott Hippie in a dunk tank on the first day of classes. And I want to thank our students, Paul and Shuri, for the great introductions. Shuri, it's wonderful to be introduced by a woman with such great potential. You should think about running for office someday. As the still relatively new Chancellor of WSU Spokane, I'm very honored to be here. Paul Ramsey has been a fantastic partner, and Paul, you're very modest, but your legacy and what you've built, it's really nationally renowned, and to be able to be partnering here today and to talk about where we're headed in the future is a great contribution. You don't make these kinds of partnerships without leadership, and you have provided that leadership. I think we should all thank Paul for that. I have a lot of colleagues here today as well from Pullman and Spokane. I work with a fantastic team at WSU. I'd like to start and say that this also would not be possible without the president of Washington State University, Dr. Elson Floyd, and the regents, because they have been on board with the vision, and they took the very critical step of designating WSU Spokane as the official health sciences campus for the entire university across the state. And that's been a big part of why we are able to be here today. And also thanks to my colleagues that are spread, I think, across 3 tables here this afternoon. I also want to express my appreciation to my predecessor, Brian Pitcher, for his leadership of this campus before I got here. As Paul mentioned, we do have a few things to talk about in terms of the future, but first, let's acknowledge the accomplishment of a very significant goal. In January of 2012, this community launched the effort to fund the first 2 years of second-year medical education in Spokane. Rather than going to the state legislature, we said, we'll raise the money here to get this off the ground, and that's what enabled the partnership to move forward that has the students on campus right now. And what I'm able to announce today is we did it. We raised the $2.3 million that we said we would raise. This is a fantastic accomplishment, and as Paul has already mentioned, there are many people that deserve to be acknowledged for that, not the least of which is Rich Hadley himself and Scott Morris, who co-chaired the task force with Dr. Floyd, Marty Dickinson and Tom Quigley, HSSA's Anthony Chang and Garmin Lutz, Empire Health Foundation, and HSSA, Susan Ash and Nancy Isserlis, and so many, many more. So thank you to all the donors that have been part of making this happen. We also wouldn't be here today without the new building on campus, and I want to announce that our first-rate pharmaceutical and biomedical sciences building, which will house both medical education and our College of Pharmacy, will be dedicated Friday, December 6th. It's on budget, on time. The building is about to open, so thank you, community and legislature, for that. Finally, this last legislative session was a tough one, and I want to also, although they've already been acknowledged, ask our state legislators to stand one more time. That's you too, Tim and Michael and others. In addition